This is the Emergency Medical Minute.
Erik, good morning. Welcome to your Medical Minute. All right, so this is just a little, we've been talking so much for about a year and a half now about the opioid crisis, and this is kind of a paper to just give us a little perspective that we really are doing a good job. And it was a paper published by one of my best friends from medical school, so that's a bonus. So it's called Emergency Department Contribution to the Prescription Opioid Epidemic, and it was in Annals of Emergency Medicine of June of 2018. So this paper, the goal was really to look at, like, how are we doing? Are we really big contributors to the opioid crisis, or are we, like we think, doing a good job and it's not really our fault, it's all the other providers that are doing this? So they looked at a huge database of prescriptions called the MEPS. It's the Medical Expenditure Panel Survey. So it's a survey where they survey about 15,000 patients per year about a lot of different things, but includes their prescriptions that they filled. And they recorded all of this data. And then anything that was an opiate, they used a formula to kind of convert it to morphine equivalents so that they could compare apples to apples. So, you know, Vicodin is different than if you're using a fentanyl lollipop or something like that. So they converted it all. And anyone guess during the time period from 1996 to 2012, so a 16-year span, how much did opioid prescriptions increase in total? And this was for non-cancer pain. So cancer people get kind of a free pass. So, and because they doubled, they tripled, so they went up 647%, 647% total for non-cancer pain. And during that time, office-based prescriptions went from 64% up to 84% of the total. How about the ED? Do you think we went up? Do you think we went down? So during that same time period, we actually went from 10% down to 3.9% of the total. So while the rest of the world was kind of trending up, we were generally trending down. Now actually our prescriptions during that time period did increase by about 200%. So it's a pretty significant increase still. Having said that, you know, that means that if we only increased 200% and the total increase was 640%, there are other specialties that are increasing like 1,000% in their total opiate prescriptions. What if we were to look at, say, you know, the people who do get prescriptions, what percentage of their total opiate prescriptions come from the emergency department as opposed to like the dentist or the, you know, the orthopedist or something like that? So only 16% come from the ED. But then what if we say, well, it's different for us because we see all the drug-seeking patients and, you know, we must be the total source for all the drug-seeking patients. So they looked at the top 5%, the heavy hitters, the all-stars of opiate prescriptions that had the top 5%. And it turned out that they only got 2.4% of their prescriptions from the emergency department. So in general, I think this says we are doing a good job. You know, it's somewhat astonishing that during this 16-year time period that they looked at, our opiate prescriptions had increased 200%. So there's room for us to work in the emergency department for sure. But I'm glad that we're working on other ways to help our patients with opioid crisis, like giving out the home Narcan kits and things like that. Because while we can improve our prescribing and dispensing efforts, we're already doing a pretty good job in that regard. So that's it. So it's really office-based prescriptions. I mean, they really, yeah, in 2012, they were responsible for 84% of opiate prescriptions. So it's a lot. All right, thanks.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.